How are you?
Hello, my name is Anne Winfrey. I'm a student to provide some privacy here. My name is Anne Winfrey. I'm a student nurse practitioner. And what's your name, please?
My name is Martha.
Oh, hi. How would you like me to address you, as Martha or Miss Neville?
Miss Neville.
Miss Neville. Okay, so nice to meet you, Miss Neville.
Nice to meet
Like I
you.
said earlier, my name is Anne Winfrey, and I'm a student nurse practitioner. So can you tell me why you're here today?
I'm here to perform. I'm here for healthy assessment.
Okay, health assessment. Well, welcome to our clinic.
Thank you.
Thank you for choosing our clinic. So I'm just going to go over quick questions, okay? And then after that, then we get to the physical assessment itself, okay? All right. So so tell me, do you have any allergies to any medication, any food?
No.
None of that. Okay. So do you take any medications right now? No over-the-counter medications, right?
No.
Good. All right. So I'm just going to go over your past medical history. So do you have any? I know you don't take any medications, but have you ever been told that you have hypertension, diabetes, or arthritis, any of that?
No, ma'am.
No. Okay. So how about surgery? Have you had any surgeries in the past or recently?
Yes.
Okay. So what kind of surgery was that?
Honey.
Okay, hernia surgery. Okay. All right. So how about kids? Do you have any kids?
Yes.
How many do you have?
3.
3 kids. Okay. Have you had any reason to see a psychiatrist recently?
No.
Or ever?
Never.
No. Okay. All right. Okay. So because you're 53, I'm just gonna go over like the usual health maintenance services that we provide here. So have you had a colonoscopy recently?
No.
Okay. How about a mammogram? When was the last time you had a mammogram?
Never.
Okay, never had a mammogram. Okay. So how about a pap smear?
Yes.
You had a pap smear. How long ago did you have the pap smear?
Every year.
You have it every year. Awesome. Okay, so for your colonoscopy, you're supposed to have that once you turn 50. You're supposed to have that at least once every 10 years. Okay, and for your mammogram, you're supposed to have that at least every year. All right, or maybe at least every year, every 2 years. If nothing's wrong, then every 3 years. But if something goes wrong, you have to do it every year. Okay. And then, so do you drink? Do you smoke? Any of that?
Just a glass of wine every weekend.
Okay, alrighty. Okay, so I'm just gonna go over your family history from your great grandfather, great grandparents, your grandparents to your parents. Does anybody have any cancer? Any hypertension, diabetes?
Hypertension, diabetes.
Okay, hypertension. Okay, runs in the family. Okay, so that means we have to keep an eye on that. You have to follow up with your labs every year, just to make sure that you do not develop any of those, okay? All right, so now we are going to go over, I'm just going to do a review of, everything that's going on so far, okay? So just tell me, so I'm just going to go from your head to your toe, okay? So first of all, do you have any headaches?
No.
Okay. Do you have any problems with hearing? Any problems with vision? Do you have any cough, any nasal drainages, any of that? How about your teeth? When was the last time you saw a dentist?
Like 6 months ago.
Okay, 6 months ago. Okay, so that's good. Did you have dentures or you have your regular teeth?
I have my teeth.
You have your regular teeth. That's awesome. Okay. You don't have any gum disease, any of that, right? Do you have any problems with swallowing?
No.
Any problems with respiration? Any shortness of breath?
No.
Chest pain?
No.
Do you have palpitations? How many pillows do you sleep with at night?
2.
2 pillows. Okay, so do you get up in the middle of the night to catch your breath sometimes?
No.
No, that does not happen. Okay. Any swelling on your legs?
No.
Never. None. Okay. So how about your abdomen? Do you have constipation, diarrhea, blood in your stool?
Constipation maybe sometimes.
Okay, all right. So what do you take for that? Do you take any medication, over the counter medication for that, or do you just do fruits and water just to make sure that
Vegetable, fruits, and water.
Good.
And
That's
exercise.
that's a good option. All right. So no, there's no blood in your stool, right? Okay. So how about urination? Do you have any problems? Any burning sensation with urination? Any blood in your urine that you have noticed recently? Okay. All right. So how about sensation? Do you have any problems feeling anything? Do you have any tingling sensation to your fingers and your toes? None of that. And okay, how about, do you have any knee pain? Any problems with walking? Any of that? Okay, awesome. Thank you very much.
You're very welcome.
All right, so now we're going to go into the physical assessment. Okay, I'm just going to go as quickly as possible, so I don't waste too much of your time. Okay, so I'm gonna go from your head. So I'm gonna be feeling for any swelling, any nodules, and if I see anything that's abnormal, I'll let you know, so that we can follow up with it with a specialist. Okay, and you shouldn't be alarmed. And if you feel any pain at any point during this process, just let me know, and we figure out a better way to do it, so that you're most comfortable. Okay. All right. So I'm going to start. Wait. Let me take a look at your fingers. Okay. I don't see any clubbing. You have good capillary field. You check for your pulses. You have good peripheral pulses. Let me take a look at your hand. All right. Okay. So skin is moist and supple. I don't see any rashes. I don't see any lesions, and skin color is and you're warm. Skin color is within normal limits for your race. Okay, and you look well nourished. You don't look like you're in any acute distress. So I'm just gonna start with your head. Okay, so I'm gonna palpate for any skin lesions. I'm looking at the hair distribution. Hair distribution is normal. I don't see any lesions. I don't see any parasites either. I'm feeling for lumps. I don't feel any lumps. Do you feel pain when I'm doing this? No? Okay. Okay, so next I'm going to palpate your sinuses, okay? Just let me know if you feel any pressure, okay? So I'm going frontal, I'm going ethmoid, and I'm going maxilla. Do you feel any pain? No, good. All right. So next, I am going to palpate your lymph nodes. Okay, I'm going to feel for any swelling. So I'm going to go preauricular, postauricular. I'm going to go submaxillary, submental. I'm gonna go down to the cervical chain, superficial cervical, the deep cervical. I'm going to go supraclavicular. I need you to hunch your shoulders for me for a second. Good. I don't feel any nodules. I don't feel any swelling. That's awesome. Okay. So next I'm going to take a look at your eyes, okay? So I'm looking at your eyebrow and your eyelashes. The hair distribution is normal. I'm looking at the eyelids, the upper and the lower. And I don't see any ptosis. Everything looks good. Can you open your eyes for me? I'm just gonna look into your conjunctiva, okay? They're pink. Sorry. They're pink and moist. And I'm looking at the sclera. The sclera is china white. I'm looking at the pupils and the iris. Everything looks good. I don't see any drainage. Everything looks okay. Okay. So now I'm going to check your eyes, okay, for peripheral vision and for visual acuity. For visual acuity, you already did before you came in here, and your vision is 20/20. That means you have good visual acuity, okay. So next, I'm going to be shining some light into your eye. I'm just looking for pupillary reflex, okay. I'm going to use the ophthalmoscope. I'm going to turn off the light for a quick second, and I'm going to look for red reflex. So I need you to look straight ahead. Okay, I see the red reflex on this eye. Take a look at the other one. I see red reflex. I'm going to come close and take a look at the inside of your eye, okay? All right. I see the optic disc. I see the arteries and the veins, and everything looks okay. There's no bleeding. I don't see any lesions. I'm going to look in the other eye as well. Okay, same thing for that eye. I don't see any lesions. I just see the optic disc and the veins and arteries, and everything looks good. All right, so I'm going to check for pupillary reflex next, okay? Can you look straight ahead for me? I'm going to be shining the light in your eye, okay?
Okay.
Okay. Okay. Can you look up a minute? Okay, good. The reflex is direct and consensual. Okay. I am going to have you follow this pen light, okay? With your eyes, but not with your head, with your neck. Okay, so I don't expect you to move your head, okay? So you ready? Okay, good. So cranial nerves 2, 3, 4, and 6 are intact. Okay. Okay. Now I'm gonna need you to look straight ahead at that light right there, and then I want you to look at the pen right now. Okay. Good. Um. Pupils around equal reactive to light and accommodation. So you did perfect with that. Okay, so next I am going to check your ears. Okay, I'm looking at the pinna on both sides. I'm looking at symmetry. They're symmetrical. I'm looking at the pinna, and I don't see any lesions. I don't see any rashes. I don't see any drainage from anywhere. So I'm going to feel for your outer ears, okay? Just to see if you feel any pain. Let me know if you feel any pain when I touch you, okay? So I'm feeling the tragus. Do you feel any pain here?
Yeah, I feel cold.
Cold? I'm sorry, my hands are really cold. But you don't feel pain, right? Okay, no pain. All right. I'm looking at the pinna, both of them, to see if there's any discomfort. There's none. I don't see anything that looks abnormal. Okay, good. So can you hear this? Okay. Can you hear this? Okay. Cranial nerve 8 is intact. All right. So I'm going to look inside. I'm going to check for hearing. Okay. I'm going to use this. I'm going to do 2 tests. One is the Weber, and the second one is the Ryan test. Okay. So I'm going to get this Fox to vibrate, and I'm going to place it on your forehead. Let me know where you feel the vibrations the most. Okay. Is it on one ear more than the other, or equally on both sides? Okay. Where do you hear it? Do you hear it on both sides? Okay, good. So now I'm going to get the Fox to vibrate one more time, and I'm going to place it on the bone behind your ear, and let me know when you stop feeling the vibration. Okay? Do you feel it? Tell me when you stop feeling it. Okay. Do you feel it now?
Yes.
Okay, good. I'm going to do it to the other side. Sorry. When you stop hearing it, say now.
No.
Do you still hear it?
Mm-hmm.
Okay, good. So for the Weber test, hearing is good bilaterally, and for the Rhines, bone air conduction is greater than bone conduction, which is normal. Okay, so your hearing is perfect. All right. So next, I'm going to look in your ears. Okay, to see what's going on in there, see if there's any drainage or any abnormality. Okay, so I'm going to use the otoscope. Okay. So I'm going to be as gentle as possible, okay? Okay, sorry. All right. Oh, sorry. All right. Okay, good. Everything looks normal. I see the tympanic membrane is intact. It's gray. It's pearl and gray, and I don't see any drainage. and I don't see any lesions or any abnormality. I'm going to do the same thing to the other ear, okay? All right, same thing for this ear. Everything looks good. Tympanic membrane is intact, pearly gray. I don't see any drainage or any abnormalities. Okay. Okay. So next, I'm going to check your nose. I don't see any abnormalities to the skin. I don't see the drainage either. So I'm going to look inside your nose, okay, just to see what's going on inside your nose, okay. All right. Sorry, let me just cover this so that we reduce the infection rate. Okay, we're going to look on the other side as well. Okay, awesome. All right, so I see the septum is the nasal septum is midline. The turbinates are pink and moist. I don't see any drainage. I don't see anything that's abnormal. I don't see any lesions or any bleeding. Okay. So can you cover one nose, one nostril, and inhale? Can you cover the other one and inhale? Okay. The narrows are patent. All right. So next, I'm going to take a look at your mouth. Okay. So I'm going to need you to stick out your tongue and say, ah. Okay, good. I say that the uvula is midline. I say the tonsils are +1, which is normal. The oral cavity is pink and moist. The teeth is complete. It's intact. I don't see any lesions. I'm looking at the soft and the hard palates, and they look normal to me. Can you stick out your tongue and say ah? Stick out your tongue and say ah. Okay, good. Gag reflex is intact. Cranial nerves 9 and 10 are intact. All right. So next, I'm gonna need you to. I'm gonna check for sensation on your face. Okay. So this is soft. Okay, and this is sharp. All right. So I'm gonna need you to close your eyes and tell me when you feel sharp or when you feel dull. Okay. All right, cranial nerve 5 is intact. Okay. All right. So next, I am going to check your neck. Okay. I'm looking at your neck. Your trachea is midline. The skin looks good. I don't see any rashes or anything abnormal. So I'm going to check your thyroid. Okay. I'm going to check to see, if there's any swelling or any nodule in your thyroid. Okay. So first of all, I'm going to quickly listen to your carotid arteries just to make sure there's no bruit. Okay. Good. Good. Also, I do not see any JVD. So I'm going to go to your back. And I'm going to need you to look up a little. Look up. And I'm going to need you to swallow. Good. I don't feel any lump. I don't feel any nodule. The thyroid looks normal, within normal limits. Okay, so next I'm going to need you to turn toward back me a little bit so that I can take a look, so I can check your back. Okay. All right. So I'm looking. The skin looks normal. I don't see any rashes or any lesions. I don't see any abnormalities. So I'm going to listen to your lungs in the back. Okay. So I'm going to need you to take a deep breath and exhale every time I move the stethoscope. Okay. Feeling for the scapula so that I'm not anywhere near the scapula. All right. Take a deep breath. Okay, good. I'm gonna check for respiratory for tactile parameters. Okay, so I need you to say 99, 99, 99 as many times as you can. Okay. Okay, go ahead.
99, 99, 99.
Okay,
99.
fine. I don't feel any parameters. I'm going to check for respiratory excursion. Okay. I need to take a deep breath. Take a deep breath out. Okay, good. Respiratory excursion is equal bilaterally. I'm going to need you. I'm going to check for diaphragmatic excursion. Okay. I need to take a deep breath again. Deep breath out. Okay. Let me quickly get a ruler. Okay, it's about 2 centimeters, which is within normal limits. Okay. All right. Thank you very much. I'm going to check one more thing in the back here. Tell me if you feel any pain here.
No.
Any pain here?
No.
Okay. Severe tenderness is absent, which that is also good. Okay. So I'm going to need to turn around one more time, and I'm going to listen to the lungs in the front. Okay. Take a deep breath for me. One more. I'm going to check the mid lung. Okay. One more. One more. Good. The lungs are clear on auscultation on every lung field. And now I'm going to listen to your heart sounds, okay? Aortic, pulmonic, Epps point, tricuspid, and mitral. And I'm going to listen for 1 minute on the PMI. Okay. Now I'm going to listen for Brui, okay? So I'm going to turn this off. Pulmonic, Epps point, tricuspid, and the PMI. All right. So I hear S1, S2. I don't hear any extra heart sounds. I don't hear any, I didn't hear any gallops or any murmurs. So everything looks okay. All right. So next, I'm going to have you sit forward one more time, please. And I need you to shrug your shoulders. Okay, good. Cranial nerve 11 is intact. I'm going to need you to puff up your cheeks, please. Okay. Cranial nerve 12 is intact. All right. So next, I'm going to inspect your. I'm going to be listening to the sounds, to your abdominal sounds. Okay. Or do the abdominal exam. So I'm going to get the pick up the bed down. Okay. That's okay. All right. All right. So I'm going to have. I'm going to let's look at your stomach. Okay. I'm looking. I don't see any rashes or any lesions. I don't see any hernia. You said you already had a hernia repair, right? I don't see any bulging. I don't see anything that looks abnormal. I don't see anything that looks abnormal. I just see some striations, but nothing else that looks no other surgical scars. Okay, so I'm going to listen to the arteries and that supply blood to all the organs. Okay. Okay, good. So listen for the aorta, the renal on both sides, the iliac on the sides, and the femoral. Okay, I don't feel any brewy. Okay, so next I am going to listen to your vowel sounds. Okay. Okay, you have very active vowel sounds. Okay, so next I'm going to be palpating. Okay, your abdomen. Just let me know if you feel any pain. Okay, if you feel any pain, I'm starting with soft palpation, and then next I'm going to do deep palpation. I'll be looking for any lumps, any swelling, any nodules. Okay. All right. I don't feel any. Good. Okay. So next I'm going to be percussing. Okay. So I expect the liver to be on this side and the spleen on that side. So I expect the sound here to be dull, and then the sound here to be more tympanic. Okay. 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 All right. Everything sounds normal. All right. So next I am going to try and feel for your liver. Okay. Can you take a deep breath for me? Out. Okay. Can you take? Let me check the spleen on the other side quickly. Deep breath. Out. Okay, good. Everything seems to be normal. I don't feel any hepatomegaly. I'm also going to check for your aorta. Okay. Okay, your aorta is not palpable, which is normal because many times you can only palpate that when the patient is really skinny. Okay, so that is okay. All right. So next I'm going to check your liver for any cholecystitis. So I'm going to be trying the Murphy's sign. Okay. So I need you. Let me find your rib cage. I need you to take a deep breath. Deep breath. Take a deep breath out. Do you feel any pain? No. Okay. Right. That's negative for McMurray's sign. I'm also going to check for the obturator sign. So that's just to check for any lesion with your appendix. Okay. So I'm gonna need you to lift this leg up. Do you feel any pain here? Good. Okay. I'm going to check for the that's negative for the obturator sign. I'm gonna need you to lay on one side. So lay on your left side. On your left side, and I need you to move this leg backwards like that. Backwards. Do you feel any pain here?
No.
Okay, good. That's negative for the psoas sign. Okay, so that means you don't have any issues with your abdomen. Okay. And then okay, so how are we doing so far?
Good.
You're feeling okay?
Yes.
All right. So I'm just going to feel your pulses. Okay. Brachial and your radial. And the pulses are really good. All right. So next I am going to need you to sit up for me. I'm going to push this back, and I need you to sit up for me. Okay. So I'm going to have you do to touch your nose and touch my finger. Okay. I'm just doing neuro exams at this point. So touch your nose and touch my finger. I'm checking for cerebellar function. Okay. Go ahead. Go ahead. Go ahead. Okay, good. I need you to. I'm gonna need you to do some rapid movements for me. Okay, so okay, can you do that? Okay, awesome. That's awesome. All right. So next, I'm going to check for I'm going to use this tuning fork, and I'm checking for sensation. Okay, I'm going to put this on any bony prominences on your arms and your feet. Do you mind taking off your shoes for a second? I'm going to do it on your big toes. Yes, sir. Yes. Awesome. Thank you. So I'm going to be checking it on your big toes and your wrists. Okay. looking for bony prominence. Do you feel that?
Mm-hmm.
Okay. Do you feel that?
Mm-hmm.
Yeah. Okay. Do you feel this? Good. Do you feel this? Good. Okay. Thank you very much. I'm also going to check for sensation on your bilateral upper and lower extremities. Okay. So this again is soft and this is sharp. Okay. So go ahead and close your eyes. What is this?
Soft.
What is this?
Soft.
How about this?
Soft.
Okay. What is this?
Soft.
How about that?
Soft.
Perfect. Okay. Everything seems to be okay. So, all right, I'm gonna need you to run your heel from your just down your shin. Okay. So your heel from your knee all the way. Awesome. Awesome. That is awesome. Okay. So next, I'm going to check for deep tendon reflexes. I want to check for deep tendon reflexes. Okay. All right. So let me see. I'm going to check for that tricep. Bicep. Brachioradialis. I'm going to check on the other side. Bicep. Tricep. Brachioradialis. I'm going to check your patella. You can leave your pants on. I'm going to feel for patella. Alright, I'm going to feel for this one. Good. I'm going to check your Achilles. Okay, the other side. Good. And I'm gonna check for the Babinski sign. Okay. All right. Okay. So deep tendon reflexes were +2 on all extremities, which is normal, and negative to the Babinski sign, which is also normal for your age. Okay. All right. How are you doing so far? You doing okay?
Yes.
Do you feel any pain?
Mm-hmm.
Any discomfort?
No.
Okay. Good. So next, I'm going to need you to lay back down for 1 second. So that we can check your extremities. Okay, so I need you to move this leg towards, like outwards and back. Awesome. How about this one? Move it outwards and back. Good. I'm checking for pulses. So popliteal. I'm checking your dorsalis pedis. And it's +2. Okay, that's awesome. All right, so next I'm going to have you move your toes towards your nose, Move your toes towards your nose. Okay, step on my hands. Okay, good. You have good equal strength to your bilateral lower. Okay, so for your arms, can I take a look at your arms again? Can you squeeze my arms as hard as you can? All right, good. Good strength bilateral too. Okay, so next I'm gonna need you. I'm gonna check your joints for any impingements. Okay, so I'm gonna need you to bend your knee for me. Bend your knee. Bend it all the way. Okay, so I'm going to be checking for the integrity of your meniscus, okay? And this is the McMurray sign, okay? So I'm just gonna move it around. If you feel any pain, no pain, right? Okay. So next, I am going to have you straighten this leg, and this one, bend this one, and I'm going to move it again. Any pain?
No pain.
No pain. Awesome. All right. So next, I'm going to do the drawer test. That's checking for your ACL, the integrity of your ACL. So I'm going to sit on your foot for a minute, and I'm going to pull. Okay, everything looks normal. I'm going to sit on this one. I'm sorry. Okay, this is so negative for the drawer test. Okay, so next I'm going to be checking your LCL and your MCL integrity. So that's the varus and the vagus sign. So I'm going to have you bend your knee. Okay. So do you feel any pain?
No.
Any pain here?
No.
Okay, good. Bend this one for me too. Okay. Feel any pain?
No.
How about here? Feel any pain? Okay. Negative for the varus and vagus test. Okay, so next I am going to have you just move your ankle around as much as you can. Okay, good. Everything looks good. Okay, you don't feel any pain, right? Okay, so next I'm gonna need you to stand up for me, okay? I'll put your socks back on. It's okay. Socks back on. All right, and I'm gonna need you to stand up for me. Okay, good. Can you stand over close to the wall?
Sure.
Yes, close to the wall. Okay, so I'm gonna need you to put your hands in front of you and close your eyes. Okay, good. Negative for romac sign. Okay, now I'm gonna need you to walk heel to toe, toe to heel, toe to heel. Awesome, awesome. So I need you to walk back on your tippy toes. Walk back, tippy toes, tippy toes. Awesome, awesome, perfect. All right. So next, I'm going to have you stretch your arms for me. Okay. I need you to move your neck from side to side. Do you feel any pain? No pain. Okay. I'm gonna need you to bring your arms in front of you 30 degrees. Spread out a little bit, a little more, a little closer. Thank you. I need you to pretend you're dumping something. Okay, good. That's negative for the drop can test. Okay. So next, I'm gonna have you put your shoulder up like that, like that. Okay. Do you feel any pain? Okay, good. Same thing for this one. If they want to do this, okay, good. Negative for the shoulder apprehension test. That means your shoulder, there's no impingement to your shoulder. Okay. So next, I'm gonna have you turn your back. Turn your back for me. I'm gonna have you reach your back as far as you can with this arm, and I need to try and reach. Okay, good. Negative for the Apley's sign. So which means your shoulder muscles are intact. Nothing is impinged. Okay. So I'm ready to turn around one more time for me, please. And I need you to spread your arms out, and then slowly bring your arms down. Awesome. That's negative for the drop arm test. Okay. I'm going to check for carpal tunnel syndrome. Okay. I need you to put your hands in front of you. Okay. So I'm going to tap my finger on this nerve right here. Do you feel any sensation to your any tingling to your fingers? Okay, good. Do you feel it here? Negative for the TENOS test. I need you to put your hands in front of you and fold them back like that. Okay, okay. That's negative for the phalanx test. Okay, one more thing. Okay, I'm gonna need you to come forward a little bit. Touch your toes for me. Okay, I'm checking for any scoliosis. I see that the spine is straight. I don't see scoliosis, and your shoulders are able to. I don't see anything abnormal. Okay, well, thank you very much. You have done great. Thank you very much.
Thank you.
Okay.